Today I'd like to talk about premature ovarian failure. This problem influences 4% of American women. When period suddenly stopped or become very infrequent, like 2 or 3 times a year, then you can have hot flashes, you have mood swing, you can develop a premature osteoporosis, you lose your sexual drive, your skin and muscle look loose, and even though you're only 35 years old, you can look like 55 years old. And because the body cannot adjust the changes this fast, so the skin, the muscle just change and ages much faster, and we may look 10-15 years older than our age. So if you started having period changing, like become less frequent, and you started having all the menopause symptoms, you should really try something to restore the ovarian function, and don't wait until the period completely gone for a year. Then it's very hard to restore the ovarian function. So I have some tips you can follow to help the ovarian function. First, you have to provide sufficient nutrients to the body so that the ovaries can use those nutrients to produce progesterone, estrogen, and adrenal gland also help to produce a little bit of estrogen, progesterone. And only the estrogen and progesterone reach certain level, then it triggers the ovulation. So you really have to change the diet, avoid too much sugar, too much spicy food, alcohol. All of those unhealthy diet will make your ovarian function decline faster. And also, those unhealthy diet help develop inflammation. The inflammation can be in your joint, in your ovaries, in your adrenal gland, and that will lead to faster declining of ovarian function. Secondly, you have to reduce your stress. Stress always causing the gland function declining faster. So when you are in a stress-free environment, even you are 55 years old, then you still can occasionally ovulate, because when all the hormones are in perfect balance, the ovaries can release eggs and restore the ovulation. So try to do yoga, qigong, meditation, anything can bring down your stress every day will help your ovaries, your adrenal gland, your thyroid. You will sleep better and function better. If the symptoms, like the menopause symptoms, become worse and worse, you have to use acupuncture, electrical acupuncture, twice a week for the first 12 to 24 treatment, and then switch to once a week. That helps bring the energy to your ovaries and the uterus, adrenal gland. So I have women come to me already stopped the period for 2 years, and after acupuncture, they can have period occasionally, which help cleanse the body. And if you don't want to do twice a week, then you can combine the herbs. Chinese herbs can help you restore the endocrine system function or improve your digestion, reduce the inflammation, treat the root cause of the ovarian failure. So if you can reduce the stress, provide sufficient nutrients, and using acupuncture and herbs, you should be able to bring back your period, not every month, but every 2 or 3 months, and then your body can avoid quickly declining the function. So you can keep your bone density, your skin looks smoother, and your muscle look stronger, so you won't have a drooping skin, drooping muscle when you are only 35 years old.